talk about the female body and understanding the basics of it if you are trying to conceive, to understand the facts that will help you with conceiving. So basically, the ovaries produce egg in every month, and the uterus responds to it by creating a lining which is supposed to help in implantation of a fertilized egg. So basically what happens is, starting from the menstruation, the initial half of the menstrual cycle, there are hormones called FSH which will help in helping the egg in getting matured. So as the egg grows, also with the help of the hormones that it releases, the lining of the uterus also grows. Now by the time you reach your mid-cycle, there is a release of another hormone called LH which helps in maturing the egg or making the egg ripe. Once the egg is ripe, it is released from the ovary, then it is caught up by the tubes and it comes and stays in the tube for about 12 to 24 hours. So it is important that your ovaries are releasing the egg at the correct time. It is important that the hormones which are associated with it, they have a well coordinated phenomenon between them, and the lining of the uterus responds very well to it. So at a time when egg is available, when sperm also comes up through the reproductive tract to meet the egg, to fertilize the egg, that is the time when fertilization can happen and a pregnancy becomes possible. This fertilized egg grows inside the tube for several days. Slowly it starts a journey towards the uterus. Now this is the phase where ovulation has happened. The lining of the uterus is growing towards making it more receptive to accept the fertilized egg to create a pregnancy. This is helped with the help of a hormone called progesterone, which again comes from the ovaries. So the lining becomes thick, ripe, mature. The egg comes in and gets attached to it. If it gets attached, then a pregnancy is resultant. So the second half of the menstrual cycle is called the luteal phase. This is the time when if a fertilization or an implantation of a fertilized egg has happened, you are going to miss your periods later. If not, this lining is going to shed in the next few days' time, at a time when the follicle from the ovary or the remnant of the follicle from the ovary has also disappeared. So this is the start of another menstrual cycle. Again the FSH level is going to go up, create an egg which will become ripe again by the help of the LH hormone and also create a lining, then another chance at fertilization and implantation and to see whether a pregnancy results. So you need to understand very well what are the fertile days for you. You need to track your fertile days. So it's very easy. If your cycles are regular, let's say between 28 to 35 days, which is the average cycle duration for most of the women, then if you are having relations between say day 10 or even day 8 of the menstrual cycle till say between day 20, that should suffice. That should cover the period, the fertile period when the egg is available for fertilization. Now, how frequently should you have relations? Well, it's up to you, but very infrequent relations may miss out the opportunity of the egg being in the system. On the other hand, having relations very frequently or say every day may become extremely stressful. So, a reasonable approach would be probably to have relations every 2 days, because sperm can stay in the lady's body for about 48 to 72 hours in a good fertilizing condition. But the egg itself will dissolve within 24 hours if it is not fertilized. To track ovulation, there are many tools available these days. There are apps available, so you can do online tracking. There are methods like previously we used to advise the basal body temperature method, or look at the type of discharge that you are getting. Close to ovulation, nature has made it in the way that it becomes very thin and it becomes very easy for the sperm to cross it at the time close to fertilization. So when you can track the type of discharge, if it is very thin, liquid discharge, that is the time for having relations if you are trying to conceive. Or there are ovulation kits, ovulation predictor kits available that can help in detecting the increase in the LH level that we just talked about, which will help you in assessing the time for having relations for conception. There are many variables in your lifestyle, in your health, which will affect your fertility. If If you are a smoker, if you are a heavy drinker, if you are not maintaining an ideal body weight, please look at that. If you are not maintaining a good healthy diet, again I would say look at that. Take a good amount of antioxidants, fruits, vegetables, nuts, do regular exercises, take good care of yourself, manage stress, do not overuse the gadgets which are available and which are very attention diverting. Maintain good harmony with your partner. All these things will take you a long way if you are trying to realize your dream of becoming a parent. Thank you.